Hello, my friends. You are listening into episode number 166 of the Girls for Greatness podcast. I am your host, Delia Perry, and it is seriously such an honor to have you here listening into this podcast. Thank you for giving me a little of your precious time today. I promise today's guest will not disappoint. I have a feeling that many of the topics we are going to be discussing today will be relatable to many of you. Today, I have the honor of welcoming Dr. Alyssa Dweck to the Girls for Greatness podcast. Dr. Dweck is a practicing gynecologist, and she is also the Chief Medical Officer of Bonafide. Dr. Dweck has been an OBGYN for over 25 years with a special interest in menopausal health and training in female sexual health. She is the co-author of 3 books, and she has appeared on the Today Show, Good Day LA, and Dr. Dweck is also a regular contributor to multiple prints and online media outlets. She was even voted top doctor in New York Magazine and Westchester Magazine. Dr. Dweck is someone who is truly passionate about empowering women to thrive in life and not just merely survive. And I'm so excited to hear from Dr. Dweck on how we can all do exactly just that. So with that, Dr. Dweck, welcome to the Girls for Greatness podcast. It's so wonderful to have you here.
Thank you. And thank you for that wonderful introduction. Very grateful.
Yes, of course. Well, tell us maybe a little about where you're from and maybe even a little about, I was curious even, how you chose the OBGYN field to begin with.
Yeah. So I am a born and bred New Yorker. Usually everything is very fast paced and frenetic for me, although I did spend about 10 or 12 years in Philadelphia training. I was immediately drawn to OBGYN in the strangest way. So when I was in high school, I was looking for a summer job. And, I always liked being in hospitals. I had been a hospital volunteer. Lo and behold, I applied for any sort of paying job at a local but big hospital. And where did they put me? As the labor clerk in the labor and delivery suite in a super busy hospital. And it was so dramatic. I found myself very, very drawn to the nature of the field with everything happening on an urgent basis, but happy stuff, not such happy stuff. I love the mentors and the doctors that I met there and really found myself attracted to that drama, and the rest is history. So, OBGYN really lends itself to medicine, to surgery, to connecting with other women,
right,
understanding what it is you're taking care of people for, because, after all, you've been through some of it on your own. So,
yeah, that's awesome. That's awesome. What in particular kind of led you to zero in on menopause and I guess all the things that go along with that, which I know we'll kind of dive into, but I'm curious what kind of led to that.
Yeah. So, it's interesting in OBGYN, your practice tends to age with you. So, we all start out young, green, and taking care of lots of college students, people who need birth control. We then sort of graduate to people who are, becoming pregnant and having their families. And that spans usually 10 years or so. And then after that, especially when we give up the obstetrical portion of our practices because we need a little bit more sleep.
Right.
You see your patients aging the way you do and going through and traversing the perimenopausal time and then menopause. So I would say it was just a very natural transition. In terms of female sexual health, which I really just have a special interest and training in, it's a perfect complement to taking care of women in the perimenopausal and menopausal times because, often I find that women are having challenges, and who better to come to but their gynecologist who they have known and trusted for year after year.
That's so true. That's so true. And you guys, I have to say, when I first had Dr. Dweck's information cross my email, excuse me, I was really drawn, especially to her and just what she's doing and her focus, because I know that this is actually a topic that I've not hit on yet. And for me personally, all kidding aside, in full honesty, this is a time in my life where I myself am going through many of those things. And I was just like, oh my gosh, like I have these questions. And I'm sure many of you listening in who maybe in that stage, and maybe even those of you who aren't there yet, you will be. And I think, some of the things we're going to have to say, will really be relatable. But for those who don't know, Dr. Dweck, can you tell us what exactly perimenopause is?
Absolutely. So first of all, every person who has ovaries is going to eventually go through perimenopause and menopause. It is inevitable.
Mm-hmm.
I like to frame it in a positive way because, after all, what's the point of thinking negatively about something that's basically going to happen? Menopause is defined as 12 consecutive months without menstruation, usually after the age of 40 and for no other obvious reason. Perimenopause are those years leading up to that time, because menopause is really sort of a hindsight recognition, because you have to already have traversed those 12 months.
Right.
But perimenopause can last 4 to 8 to 10 years. And this is a time where ovaries are functioning, but they are starting to become a little bit volatile in terms of ovulation, regularity, production of estrogen, production of progesterone, and even testosterone. So hormones are becoming a little bit more variable, and symptoms may start. They may at first not be so recognizable, but like I said, it can take 4 to 10 years.
Interesting. So what would you say for women, before I jump into menopause, in that stage? What are some of the things that you see, I guess, a lot of women struggling with, or what are some of the the myths around that? Because I know I had my own, and it's really interesting to hear someone else's take, because there are different opinions and there are different approaches. And I know we can get into that with menopause too, but I'm curious for you, like, what are some of the things that you run into with the women you see?
So everybody has their own unique journey. We can certainly look to our mothers, because there's quite a bit of genetic impact on what the perimenopausal and menopausal journeys are going to be like. We also have to focus on our lifestyles, because that in part is one of the most important elements in helping to traverse these issues. The most common symptoms that people report to me in my office, or who, people come into me for, would be, irregular bleeding habits. So changes in the menstrual habits is very iconic of perimenopause, whether that means skip menstrual cycles, longer cycles, shorter cycles, a change in the nature of bleeding or in the color of bleeding. So that would be number one. Some women are already managing things like hot flashes or night sweats, which are like hot flashes that occur during night when you're sleeping. Many people are reporting mood changes, irritability, feelings that they don't recognize themselves sometimes because their moods are a little volatile. Some people are complaining of weight change, particularly around the middle area. So I would say those are probably some of the more common perimenopausal symptoms. But of course, the laundry list of potential symptoms, is present.
Right.
And then, so, I'm managing all of these, I'm helping people to manage all of these symptoms, whether it's one by one or all as a combination of menopausal type symptoms.
Sure. Does a lot of that shift then when you go into menopause? I mean, I know that probably some of the symptoms can be the same or at least heightened, or I'm just curious, like, what you'd say about that. Like, what's...
it's a great question, because, there are certainly stages. There's perimenopause and then there's menopause, which truly is like one day in time. And then there's postmenopause, but there are stages, early, late, and whatnot. But really, it's all a continuum. I would say the changes in bleeding habits are hallmark of perimenopause, along with what I've mentioned. During menopause, hot flashes, night sweats, weight change, difficulty and disrupted sleep, joint pain, headaches. Those things are common. And one of the later symptoms that often is somewhat of a disconnect for people is vaginal dryness and changes to sexual function, whether that's pain, whether that's just dryness, whether that's a libido alteration, changes in orgasm potential. So all of these things are fair game. And like I said, everybody has their own story to tell, but all is fair game.
Sure, sure. And I know that there's different ways, I'm sure, obviously, to address many of those things, and different things that I know we could hone in on. But I'm curious for you, like, say you have a woman that's coming to you and, let's say they've stopped their period, or they're on their way out on that end, and they've experienced weight gain, and maybe even, let's just say, they're mentally, they're struggling, whether that's with irritability or clarity or any of those things. What, I guess, alternatives, or what things are out there that they could do versus hormone replacement therapy? And I'm curious, just tell us first, I should have backed up and said this. What exactly is hormone replacement therapy? Because that's even a question I had when I started this journey, is like, what does that even mean? And, what are my alternatives to that? And so I'm curious, like, what you say about that.
Okay, so definition-wise, menopausal hormone therapy or hormone replacement therapy usually involves estrogen, so providing estrogen that the ovaries are no longer making very much of, or any at all. And for women or people who have uteruses, we also need to add a second hormone called progesterone or progestin, and that's in an effort to protect the uterus from an overgrowth of tissue on the inside that estrogen can cause. And so that's the traditional combination hormone replacement therapy. We can get into as much detail as you like, but estrogen can come in the form of a cream, a vaginal ring, a tablet, a patch, and there are different nuances that go along with that. Same with progesterone, typically comes in the form of a pill or perhaps a cream, and sometimes even an IUD that secretes progesterone. Again, we can get into nuances if you like. And I think that it's important to recognize that hormone replacement therapy is basically FDA-approved medication for indications of hot flashes, night sweats, and protection against bones and vaginal dryness. Those are things to keep in mind. A long while ago, there was a study called the WHI. It studied loads and loads of women on a particular regimen of hormone replacement therapy. They actually had to stop the study early because they noticed a trend in these people developing breast cancer, and those who were taking that was higher than anticipated. And lo and behold, the use of estrogen and hormone replacement really plummeted as a result. In hindsight, it turns out that a lot of the data was either misinterpreted or misunderstood for lots of different reasons. So hormone therapy is making a bit of a comeback because we now understand it better. With that said, when I see a patient in my office who's complaining of the gamut of symptoms that we spoke about, I tend to start with the conservative and then move to more aggressive management. So naturally, the first thing to think about is lifestyle, diet, exercise, stress reduction, eliminate smoking, work on community and having support. So those are big things. And I encourage people to start that early, well before or during the perimenopausal time, so it doesn't hit you like a truck and you can already be ahead of the game. Next, I often recommend herbal products. I do have a background in nutrition, so I studied human nutrition before I even became a doctor. Unfortunately, we don't get much training in nutrition in medical school, so I felt really advantaged to already have that background. But I work for Bonafide Health, and I am thrilled to report that they have herbal supplements, multiple supplements, to address the different symptoms of perimenopause and menopause that are causing people to have a poor quality of life. And the beauty of these supplements is that rather than, we all hear about so many different products available that it's kind of like the Wild West out there. But these supplements have clinical studies behind them to suggest that they're safe and also to suggest that they're effective. and they are heavily researched. And that's why I can stand behind them, because I'm the person reviewing a lot of these studies.
Right.
And we have many, many healthcare providers who are on board with that. So there's supplements for hot flashes, for vaginal dryness, for some of the mood irritability, etc. Next, we move on to pharmacologics. There are antidepressants, believe it or not, that have been indicated for hot flashes and night sweats. There are other medications, one called gabapentin, that can be helpful, and then hormone therapy. So it's really a very individual shared decision that we make with our patients based on their medical history, based on their desires and wants. They've been brought up with certain values and cultures. And frankly, there are a lot of women who cannot take hormones due to medical issues like breast cancer, like uterus cancer, like propensity to blood clots. So these are people who really do have to focus on the lifestyle and alternate options.
Interesting. Can someone be, or let me ask you this. So can someone be deficient in estrogen and not in progesterone, or deficient in progesterone and not in estrogen? That was one thing that crossed my mind when you were explaining all that.
Yes, but it's more complex than that. So yes,
okay.
Estrogen, progesterone, and also testosterone, as well as multiple other hormones and neurotransmitters, they are in kind of a fine balance.
Okay.
And during perimenopause and also menopause, because of the decreased levels or volatile levels of estrogen production from ovaries, the balance can be out of whack. And so, yes, there can be differences. But again, we can address the symptoms that these imbalances and these hormone changes cause.
Right. What recommendations would you make? And I know this is probably it could be answered many different ways, but I'm just kind of going back to what you said about lifestyle and nutrition, especially with your background with nutrition. And I know you have history in that, and you yourself lead a very healthy lifestyle. And I'm curious, usually, I get it. We all have our moments. We all have our moments. Exactly. No, me too. But as a whole, I guess maybe what are some of the things that you found even for yourself that have worked, and things that you recommend? Because I think that is a piece that so many women that I know, not just my age, but those that are maybe a little younger, a little older, that they're struggling with. They're like, I have now hit this age and I'm like, holy shit. Like the things that I, was eating before, the things I was doing, it's just not working anymore.
Yeah.
And, so I think that's just a huge, it's been an issue for many women out there.
It certainly is. And myself included.
Yeah.
And
same
people. So, part of this is just natural aging, where we will gain weight because we lose muscle. Muscle is our metabolic tissue. Also, muscle is where energy gets burned, in other words. So aging in general will, be an uphill battle with that. And then, of course, the menopausal changes, mainly lower estrogen, because we have estrogen receptors everywhere in our bodies. So this is what I recommend, truly recognizing that we're all going to have good days and bad days, but it's a matter of maintaining a lifestyle. So diet-wise, I recommend the Mediterranean style of eating. This is not a diet where you're going to go on and say, I'm going to lose 20 pounds. This is a lifestyle, and it's healthful. It's meant as a cardioprotective diet. It also tends to enhance immunity, or at least maintain good immunity. It is naturally low glycemic, so that you don't get those big peaks and valleys of insulin and sugar. And that's really important, because guess what happens when you have big bouts of sugar? You get hot flashes, and then you may perspire. And so when that's put on top of menopausal hot flashes, it can really be quite uncomfortable. But it helps to maintain weight naturally, because it's a low glycemic type of diet regimen. This includes lean proteins, lots of fruits and vegetables, olive oil instead of butter, minimizing but allowing for alcohol use, and avoiding processed foods, avoiding sugars. So that's it in a nutshell, but there's plenty of other nuances. Calorie-wise, I'd say 1,200 calories to 1,500 calories per day is really where most of us are going to be able to maintain and or lose a little bit of weight.
Okay.
I also think, and there are studies to suggest this, the standard regimen is out of 24-hour periods. 16 hours of that is straight on with just hydration, coffee or whatnot. And then the other 8 hours is where caloric intake can be introduced. And this is difficult for some people,
Yeah.
but for others, like myself, where breakfast was never
Yep.
a meal that I enjoyed, this is
Same.
not as hard as it sounds,
Right.
and it tends to be helpful metabolically. Exercise wise, the standard recommendation is 150 minutes a week of cardio. You've got to burn calories, and you should do something that you actually enjoy so that you stay on the wagon, or mix it up a little bit and run, bike, dance, whatever is something enjoyable. And then at least 2 to 3 days of some sort of weight training, flexibility or strength training, balance training, because these are all things that are going to help protect bones, burn calories, tone you, try to help avoid that weight gain around the middle, and help with longevity in general. And then lastly, stress reduction, which is a very tall order, especially these days. But whether it's yoga, meditation, mindfulness, exercise, whatever works for you, stress reduction, because you don't want your adrenal glands to be pumping out cortisol 24/7, because that aids and abets with that visceral fat formation in the middle. So I know that's a lot.
No, that's so true. That's so true.
But in a nutshell.
That's so great. It's so great. I think one of the things that I've noticed just recently, those of you listening in, that I've really had to adjust and work at, which is not easy for me because I am go, 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 is to make sure that I get to bed at a decent time. I'm finding that that is making a huge difference in my ability to maintain weight and my ability to just feel so much better the next morning. And I know for some, it's really hard to sleep, but just making myself go to bed earlier, it seems to be making a huge difference.
I couldn't agree more. So we talk about quantity of sleep. So 7 to 8 hours is ideal. And we talk about quality of sleep. So if somebody is waking up 2, 3, 4 times a night, whether it's to use the bathroom or if it's because you're having a hot flash, what I hear up for these reasons, and then they get back to bed and the busy mind takes over. They can't get back to sleep because they've got so many racing thoughts. So this is where mindfulness can really come in and be helpful. Second thing is just general sleep hygiene that we often take for granted. Keep the room at an ambient temperature. Cold is better when you're sleeping. Better to have some blankets but be in a cool environment. Get rid of your screen time right before bed, probably like an hour, because that blue light really interferes with the general brain activity that helps with sleep. Alcohol. So we all like our glass of wine or two, but alcohol is a big sleep disruptor. So really mitigating that or modifying it so it's, at limited times can be helpful. So I think those are some general hints. And then manage symptoms that are getting you up at night. If it's hot flashes, we have to take care of that. Relicin, which is the herbal supplement I was telling you about, really has in studies shown to help to improve quality of sleep for women. Also, if you're getting up in the middle of the night to go to the bathroom and that's what's waking you up, think about restricting fluids after a certain hour of the afternoon or evening. Avoid caffeine, which of course makes you stay kind of energized and awake. So little things like that may really go a long way.
That's so true. That's so true. Those are all great tips. One other thing I wanted to touch on really quickly. And again, I know this is something you guys that I could have dove into in great length, but I guess just tell us a little about maybe what we need to know in terms of, let's say, perimenopause and menopause, that whole time period, and our sexual health, how those two can, how those things can shift, and how that whole, area of our life can be disrupted, just like so many other things of our life, can be disrupted. And I think for some, I know from some of the girlfriends I've talked to, they kind of feel like, well, what is wrong with me? And I'm like, well, I don't really think there's anything wrong. I think this is just
Yeah.
part of the changes that are, that are occurring, and things that we have to address and deal
Yeah.
with, and not just be like, this is the way it's going to be. I mean, from day one, have been refused to think that that's that's the way to go. There's
Right.
got to be answers and help.
Well, look, a couple of things, because this is such an important topic. And oftentimes it's such an important topic that I will dedicate a whole visit for this alone, because
Sure.
this isn't something you can just sprinkle
Right.
into your annual visit. But first and foremost, just a little factual myth. During perimenopause, so before you've gone 12
Mhm.
months without menstruation, if you are having sex with a man and you are still menstruating, you need to consider contraception of some sort, because pregnancy is still possible. It's less likely, it's suboptimal, but it's still possible. So I just wanted to put that in there.
Sure.
Number two, perimenopausal women and menopausal women are still potential to get a sexually transmitted infection. So taking the proper precaution with a condom or whatnot, if you are with more than one partner, or partner that you have concerns about, is very important. So that's the medical stuff. Now, in regard to menopause, I think in office, the most common complaints that I see are either related to painful sex, either due to dryness or something along that line, what we used to call vaginal atrophy, changes in the vagina that cause the tissue to be super delicate, less elastic, prone to injury, and in need of some moisture in one way or another. The second complaint that I see a lot is weakened or absent orgasm. And this in part can be hormonal, but also can be related to where you are in your brain, because, we all know that one of the largest sex organs for women is the brain. Number three would be libido. So, sexual drive, and how does that change as time goes along? And that is a complex one, because for women, this has psychological factors, emotional factors, relationship factors, medical factors, so hormonal factors. So there's a lot to unpack there. So those would probably be the most common concerns and complaints that I hear from my patients.
Sure. That's great.
And
I'm sure there's ways to address all those.
Yes, there are many ways to try to help manage those concerns.
Sure. That's awesome. Well, before I kind of jump into my last couple of questions, I guess I'm just curious what you would say. I know that, again, this is a very broad question, but let's just say your maybe top 3 suggestions to women out there who are just maybe in this space of, they're either in perimenopause or menopause. Maybe they're not quite there, but they're just on the cusp, and they're just feeling off. Like, and they don't want to, they might feel like, am I losing my mind here, or what, what's going on? And I think that's kind of how you guys, I mean, sometimes I think this is how you kind of feel, but,
yes, people constantly wonder whether they're normal. I mean, I hear that all the time. Is this normal? Am I normal? I think my top 3 concern or pearls basically would be, make sure you are up to date with general medical care, because it's very easy and quite common actually to blame all your symptoms on hormone changes, perimenopause, menopause. But from time to time, we actually pick up a medical issue that needs to be addressed in a totally different way. For example, let's just say a thyroid problem. Thyroid gland manages your metabolism. When it's off, all kinds of havoc can be wreaked. So that's something to address. Number 2, lifestyle matters. So really, whatever is going to work for you, diet, exercise, stress reduction, these are just absolutely tantamount. And I think being proactive is key. I guess the third pearl would be educate or get educated and communicate. So learn as much as you can from reputable sources like this podcast, or from, the North American Menopause. Bonafide Health has wonderful blog material on menopausal and perimenopausal issues, so that you're actually arming yourself with information, and you might get a lot of reassurance. but communication is communicate with their male partners or their male friends or any male associates, and they can't necessarily read our minds or understand what we're going through from a physical standpoint, because after all, they're not living through it themselves. So, bring them into the picture if that's important to you, and communicate directly.
Yeah, that's really great. Really great advice.
Yeah.
So my last couple of questions that I ask all my guests, kind of shifting gears completely, but and then I'll kind of wrap things up here. But tell me 3 words that best describe who you really and truly are.
Oh boy. 3 words. Okay. Ball of energy. How about that?
All right. I love that.
I got it all done in one phrase.
In one phrase. I love that. I could see that. I know. I love it. Okay. And next question, one thing you are currently working to improve upon in your own life.
That's a tough one. I'm always trying to improve upon something, and I guess I'm really thrilled to be embarking on being the chief medical officer at Bonafide. This is new for me because I'm used to being a practitioner, 24/7, 365, and I still want to do that, and I still will do that. But I feel it's really important for everyone, but definitely for myself, to spread my wings and broaden my horizons. And I'm really glad I have the opportunity to do that in my field of interest.
That's awesome. That's awesome. And my last question, Dr. Dweck, what's one thing that you are proud of yourself for being or doing?
Two beautiful sons that are adults, and that's the hardest job ever. So
that's awesome. That's awesome. Well, thank you so much for being here. I've learned so many things, and I'm sure those of you listening in have just been enlightened and have just grown and learned as well from what you've had to say. And I really appreciate you taking the time on this Wednesday evening to talk to us. So thank you so much. And I really commend you for everything that you're doing to just, like I said in the beginning, help other women, to thrive and not just kind of survive in life, but to realize that there's answers out there to all of our, things that are coming up. So
agreed. Thank you for having me. It's my pleasure.
Yes. Thank you.